special guest today, our expert panelist. Joining us today is Barre, Respite Administrator with the Arc Montgomery County. Jules works closely with caregivers and families throughout our community and helping them understand and access respite care resources that can provide meaningful relief and support. And during today's conversation, we'll discuss what respite care is, who may qualify, common misconceptions about eligibility, how the application process works, and resources that can help you continue caring for your loved ones while also caring for yourselves, So just a quick note, if you have any questions, just put them in the chat box. We're going to be answering them as we go on. When the timing is right, when the, timing to answer that question is right, just let us know. Anyway, as always, our goal in our coffee chat is simple: to connect our community with practical information, trusted resources, and people who can help. And again, thank you for being here. Grab your coffee, settle in, and let's get started. Without further ado, let's call on Jules. Jules, the floor is yours.
At Visiting Angels, we're committed to enriching the lives of elders and their significant others. Our monthly coffee chat sessions aim to make your lives easier and better by providing quality information from our expert panelists. We're here to elevate your quality of life, offer practical wisdom, and ensure you have access to valuable insights.
Thank you so much, Dexter, and thank you, Visiting Angels, for allowing me to talk about respite today. And good morning, everyone. I hope you're doing well, and I hope you're having a great day. It's a beautiful day out here today, so I hope you all are enjoying this beautiful weather. We're going to talk about respite today, respite coordination. I am the Respite Administrator with the Arc Montgomery County. The Arc Montgomery County has been awarded the contract by the Department of Health and Human Services, and that's where our funding comes from. The Arc doesn't deliver the direct respite care, but we work with a consortium of home health care agencies like Visiting Angels. Visiting Angels is one of our largest providers that families use in respite program. We also work with Adult Medical Day, Adult Social Day, and Assisted Living, where you can use your respite hours at any one of those different settings. So the first thing is how you want to see if you're eligible. So I'm going to share that eligibility. We have a questionnaire that will be on our website beginning July 6th. So Dexter, can you bring that up for me in the chat? Let's see. Did you get that? Can you bring it up, or I could send it again?
Yes, please send it again. I'm looking
Okay.
at our chat here.
So just to let you
Here.
know, you want to make sure you're eligible for respite. And on July 6th, we will have an online application ready for you, but you want to make sure you're eligible. And to see if you're eligible, can you see that screen, Dexter?
Yes, I can, and I've
Okay.
pasted the
So
link as well.
the screening for the eligibility would just take a few minutes. You must be the unpaid live-in primary caregiver taking care of a loved one in the same Montgomery County household.
Oh, hold on, Jules, did you open the link? I can only see the like the fill out, but not the questionnaire or the,
Oh, you
is there
can,
maybe we need to reload
let's
it.
see. Okay, how's that? Can you see that now?
Let me check. There you go. I can see it now. First name, last name, email,
Yep, okay.
etc. All right, good.
So I would put my first name in here, my last name, my email. We just actually got this, so and then you hit next, and then it says, does the primary caregiver and the care recipient, that's the person you're caring for, reside in the same household as Montgomery County? If you say yes, it'll take you on to the next page. If you say no, it's going to come up and say, thank you for beginning the application screening, but based on your results, you're not eligible. Oftentimes we get a aging senior that is living alone and they want to apply for respite, but unfortunately, respite is designed to give the unpaid live-in full-time primary caregiver a break from caregiving. So we're just going to go back to, okay. But if you had any questions, you can call me. This link is just not working in the SharePoint, the sharing site for some reason. I don't know why, but it's not working. But let's see. I don't know if you could share. It's not working. But basically, again, it's going to take you through the steps to see if you're eligible. Eligibility requirements is you must be the full-time live-in unpaid primary caregiver taking care of a loved one, a senior, for example, but it could be a spouse caring for a spouse, a sibling caring for a sibling, but you must reside in the same Montgomery County household. And we define a senior as age 60. We also report for children and adults with disabilities as well. Unfortunately, we do not support anyone with a mental health diagnosis that's over the age of 18. It is not income-based, which is good. That's the first question people want to know. Is there income-based? We do ask about your income and your household size, but your name isn't given to anyone. It's just for data collecting that the county wants us to collect that data for them. So if you are not receiving any kind of Medicaid waiver, you would be eligible. However, if you recently signed up for the Medicare Guide program, you need to use your Medicare Guide respite hours first before accessing our program. So that's something new. And just many of you may know this, that Visiting Angels is a Medicare Guide provider. And they know all the rules about that. So the new rule is you can get respite and the Medicaid Guide program, but you must use your Medicare Guide hours first. Then you can tap into the respite hours. So that's something new this year. Once you come in, if you're new, we conduct an orientation with you. We go over the guidelines of the program. We help you pick a provider out based upon your loved one's need, and you start using your respite hours. Something that's important, you want to use your respite hours. You're eligible for 120 hours in fiscal year 27, which is also something new that has changed. But if we don't have funding available, we can't approve those hours. So we always encourage you to use those hours. We had a lot of family members enroll and did not use their hours, and now they want to use them. And unfortunately, our funding is exhausted for this fiscal year. So I totally understand that 120 hours is not a lot of hours, but you do want to use them because if you don't, you'll lose them. And it also prevents other people from applying. So we encourage you to use your hours as much as possible. We send an authorization form over each month to the agencies if we have approved those hours. An agency like Visiting Angel is very familiar with our program. We've been working with them for over 20 years, and they know this program very well. They come in for a renewal of the guidelines, so they're kept abreast of all the new rules and policies. But I've met with many of the people at Visiting Angels already this year, and they're very familiar with the new guidelines. So that's basically respite in a nutshell. So if you have any more questions about it, I'd be happy to answer them. Is anybody enrolled in respite right now? If you could put that in the chat.
Well, we don't have there, but we do have some questions here, Jules.
Okay. So does it fall under homebound services? I'm not sure what you mean. We do have families that have loved ones that are homebound. They are actually bedbound. So remember, you must be the unpaid live-in primary caregiver taking care of that loved one in Montgomery County. So I hope that answers your question.
Okay. Would you like me to read the other questions, Jules?
Sure.
All right, so this is from Linda. I have been emailing to learn if this is for DC residents as well and just put it in the chat but cannot get an answer. Please advise so I know whether to stay on this call or not.
No, it is not for DC residents. You need to call the Department of Social Services in DC. They do have a respite program, slightly different than ours. This program is funded by Montgomery County Department of Health and Human Services. So this program is for Montgomery County residents only. There are a lot of other counties that support respite in Maryland, but you need to go to the Department of Social Services where you live. So if you live in PG County, Carroll County, Calvert County, you want to go to the Department of Social Services. Montgomery County puts Department of Health and Human Services puts a lot of funding aside for respite instead of having the Department of Social Services administer the contract. They have the Arc of Montgomery County to do that.
All right. So, Jules, I'll just for the benefit of Linda here, would it still be valuable to stay on the webinar for, the processes and whatnot, just a change of, setting or?
No, I mean, unfortunately, we would not be able to help her if she lives in DC. But
All
she could
right, all
certainly
right.
call Washington, D.C.'s Department of Social Services, and it would be under the Aging and Disability.
Okay, okay. So another question here is, if the family caregiver lives a few houses down from their loved one, are they eligible for respite?
Unfortunately not. You must reside in the same household.
Okay. So those are immediate questions for now. If there are any other questions, let us know, guys, in the question box or the webinar chat. Jules, all yours.
So for the family just asked if if they're not residing in the same household, you might want to check if you're eligible for another services. It is income based. It's called IHAS, IHAS, which stands for In-Home Aid Services, and you can call the 240 777 3000 number. Someone from Aging and Disability Resource Unit, you can ask about if you would be eligible for I. And that program is income based though, and they may be able to get you some services. For those who, and if your loved one has Medicare A and B only, you might want to check out the guide program. And I know Visiting Angels can provide you with information. They could tell you quite quickly if you're eligible for the guide program. The number is 240-777-3000. And here's the link as well.
All right, I've posted the number and the link as well at the chat box. Thanks,
Yeah,
Jules.
sure.
Okay,
And Dexter, do you have the link to the guide program? Do
link
you
to the
have
guide program.
yeah, so you may they could call anyone at your office. They can call Jill
Yeah, that's
Lilly.
the best thing.
Yeah,
Call
so if
Jill.
you want to put Jill's contact information and to see if your loved one, especially if you're not residing in the same household, if you have Medicare A and B only, no supplement, and your loved one's diagnosed with cognitive decline, they may be eligible for I believe around 65 to 70 hours of respite. They basically will pay for dollars worth of care, which is averaging 65 to 70 hours, depending on where your location is. And we've put Jill's name in there. Give Jill a call to see she can let you know if you're eligible for the Medicare Guide Program.
All right, so I just pasted the contact email of Jill in the chat box, everyone. So we'll just be compiling these links and contact emails, and we'll have the replay of this webinar and resources sent to you via email as well.
And just keep in mind that 240-777-3000 number is the Aging and Disability Resource Unit. And if you have any questions about housing, transportation, in-home aid services, they're going to be able to answer your questions as well. They are very busy, so be patient. They will call you back. So a few people wanted to know when the application will be on the ARC's website. It will be on our website on July 6th. I'm going to send you the link to that Just so you know, I'll send you the link, but the application is not going to be up there until July 6th. We have a notice now saying that our application is not available. So let me put that in the link. And there's an overview, and the site is really nice because you can translate it into different languages by using Recite on our website. We try our best to accommodate families who English is not their loved one's first language and try to provide providers that speak different languages. We try our best. There's about 27 different languages spoken in our respite program of the 600 people that enroll, and we can provide languages for about 22 of those different languages. Any other questions, comments?
None here so far on my end. Let me see. So we've answered the question so far. Yeah. So we've answered the question so far, Jules.
Okay. Does anybody in the room feel that they're eligible for respite? By show of hands. Okay, Ms. Z Jackson, that's great. So are you comfortable where you need to go on July 6th to our website? You can also call our office. Our application is actually going to be online. You'll be able to fill it out online. But if you need assistance with that, don't worry, we're here to help you. I also know the team at Visiting Angels helps many families with the application as well. So Visiting Angels always refers families to us because it does give you a break from caregiving and it helps you with subsidizing the cost of care. That's great, Ms. Jackson. Thank you so much. We look forward to assisting you. Anyone else think that they're eligible? Rhonda, Ramon?
I have a scenario question here, Jules.
Okay, great.
Here, if a family needs 24-hour care or overnight assistance because the caregiver is completely burnt out, can they combine these funded respite hours with private pay to call full weekend?
Yes. So for example, that does happen quite a bit. You can use your respite hours in assisted living and we could cover the 24 hours. We do have some assisted living that will do a 48-hour stay in an assisted living. But if that doesn't meet your family's need, you can use up to 10 hours a day in the home. And as long as the visiting angels nurse feel it's okay to leave your loved one alone or you pay privately, you could do that as well. Visiting Angels does accept private pay, and most of our other consortium members do as well. So you could use the 10 hours first and then do the private pay for the other hours. Yes, you can do that.
Okay, thank you very much. Here's another case scenario question. Um, what happens if a family builds a profile but their loved one's primary physician takes weeks to sign and return the mandatory health form? Is there like a workaround or something?
No, that happens a lot for our families that are enrolled in Kaiser. One time we did have to wait up to 8 weeks. If we feel that it's just going to take too long, and for example, if the visiting angel nurse is okay coming out, doing an assessment and working with the doctor, they will help you get that form in. Our consortium member works with many families' physicians. Sometimes when their nurse will send over a request, it will move faster. So we'll work with you in getting that done.
Okay, here's another question here. Can the caregivers help with errands?
No, they cannot provide errand services. That's a great question. So on our website, you'll see what's called a caregiver expectation document. And this is to let you know what the aide can and cannot do. So their role at your home is, first of all, the nurse from Visiting Angel or our home health care agencies will come out and do an assessment of your loved one. This is important because all our consortium members that provide in-home care have a residential service agency license in the state of Maryland. They are required to do an assessment of your loved one, and then the nurse is required to do what's called a plan of care. That plan of care is then issued to any aide that comes to support your loved one, and they must follow the plan of care that the nurse has put in place. For example, a certified nursing assistant in the state of Maryland cannot administer medication. Okay, so they can do a medication reminder, they can do vitals, they can assist with all activities of daily living. You may have heard this referred to as aid. So they can do bathing, showering, assist with shaving, but they cannot provide transportation or errand services. Now, visiting angels may provide that services, but you would have to pay privately for that.
Okay, let us continue with some questions. So, Jules, we know the office is incredibly small and manages hundreds of families, right? And if a
600 of them.
yeah, that's a lot. So if a family is completely overwhelmed by paperwork, can they literally walk into visiting angels, for example, in our office, and have someone help them fill out the application step by step? Is that possible?
Of course, they do that right now for us. I'm in
Mm,
very close contact with visiting. I speak to their office at least once a week. I'm familiar with their nursing staff, their scheduling coordinators, and visiting angels helps their families out a lot with our paperwork. So it's really going to be nice that our online application is up there. And if you're already going to use visiting angels as your respite provider, that is a lot easier because you know who the provider is. Sometimes the process takes longer because families can't decide on who the provider is. We will make recommendations, but the family wants to do some deeper dive into the agencies. But I can let you know that all our agencies on our consortium have a registered service agency license. They conduct in-depth background checks on their employees. Um, they they have training in dementia, and they have ongoing training in dementia. In fact, many of their aides have certified dementia practitioner training as well. And if you're
okay.
not, one thing I want to make note, sometimes you may get a different aide that the home healthcare agency will send, but if you're not, it's not a good match, you can call Visiting Angels or any one of our home healthcare agencies and let them know. It's important that you get a right match for your family member.
All right. Z is asking here, is there a link for the medical form?
That will be a part of our online application.
Okay.
That will
So,
be there. You're basically going to put your physician's name into the online application, and it will be sent to them. And
okay.
again,
All
if
right.
you're having problems with that, we can work with getting that done for you.
Okay. So Jules, another question here. Hypothetically, if a family wants to get care started right now while they wait for those approval period, right, from the county,
Mhm.
how does the transition work so they don't have to switch caregivers later? Or, what's the best, most efficient way to go about it?
If they want help right now, they can call Visiting Angels and pay privately. Otherwise, you'd have to wait till July 6th to fill out the application. And we work with
Okay.
Visiting Angels at Gaithersburg, so if you're already with them, it'll be a very easy transition.
That's advantageous, correct?
Yeah.
Okay. So here's another question here. If someone has used his respite funding in the past, do they get automatically rolled over or do they need to
No.
re-register?
No, that's a great question. On May 14th, we send out all the renewal packages to the families, and I'm getting ready to send out another reminder. They were all due on the 15th. So if you haven't done it, if you have not renewed, you should have received the packages a while ago, and you have to renew. You do not, it is not automatic. You must renew every year. That's the guidelines of the program. You must renew every year. If you didn't get your renewal package, you'll be getting an email today asking you to fill out our survey and asking you to make sure you submit your renewal package. If you moved and did not tell us, that's probably why you didn't get the renewal package. We are required to mail them out.
Okay. So while we wait for the next few questions to come out, I know some people are probably still wondering about this and that. Uh, Jules, we actually hear this one a lot from local families. So a lot of primary caregivers feel an immense amount of guilt about bringing someone else into the home,
Oh,
right?
yeah.
So from your experience working with hundreds of families, what is the best way to introduce a professional caregiver so the senior doesn't resist it?
Well, that's a great question. Oftentimes, and this especially seems to happen to women who are the primary caregivers, their loved one doesn't want anyone to come into the home. Um, and no one could take better care of them than their spouse, and that's true. But you have to approach your loved one with that you do need a break in order for you to continue to take care of your loved one. You do need a break. You need to get away. I bet a lot of you have not had time to see other family members or friends. A lot of you've probably stopped going to services on the weekend because you can't leave your loved one alone. So you have to take care of your own well-being in order to take care of someone. Uh, everybody knows that saying, if you're not going to care for yourself, how can you care for someone else? Um, and oftentimes we have people that resist, family members resist, but once they come in there, they meet a caregiver that's interested in their life story that they've probably told their primary caregiver over and over again. So it's nice to meet someone, and the stress reduction in the prime giver, time again with our surveys, they've shown a reduction in stress. So return if they've received a reduction in stress, their loved one's going to also see that as well. And we will work with the family members in trying to get their loved one to agree to it.
Mm-hmm. Beautiful. Okay. So you mentioned a while ago that these programs, Jules, work with a consortium, right? So
Yes.
does that mean a family can mix their hours, for example, using some hours for in-home care and some for adult medical day program or therapeutic camp, etc., if they choose to?
Yes, we have people that use they prefer their loved one to go to adult medical day, maybe on once a week, just to get out of the house, to engage in activities, and then they use their respite hours in the home. Yes, they can do that. We do not allow for two different agencies at the same time.
Okay. So
But you
digging
can use your
further.
hours at adult medical day. You can use it at a weekend respite, at assisted living, and in home.
All right, all right. Now digging further to this topic, can these funded hours be further used for specialized care? For example, advanced dementia or Parkinson's care, things like that.
Well, if your loved one is, we have many families enrolled in respite. Their loved one is in late stages of dementia and Parkinson, and we have two levels of care, level one and level two. Level one is unskilled care, which usually will get you a certified nursing assistant or geriatric nursing assistant or a home healthcare aide. Level two is for skilled nursing, but our rate is extremely low. And a skilled nursing would be an LPN, a licensed practical nurse, and their rate is much higher. So if you do need skilled nursing, we can only pay up to $39 an hour. So you would have to spend something most likely out of pocket. Most of our families enrolled in respite uh, need unskilled nursing, a level one care.
Mm-hmm. So for those who are interested, people are probably thinking about enrollment window, which you mentioned a while ago, right? Can we look at that further? Specifically, is there a waiting list for families who miss the deadline, or are they completely locked out until the following year?
No, if you're already enrolled in respite, if you as long as you renew, you'll get an approval letter on July 1st. If you're new to respite, never applied for it before, July 6th of this year, 2026, you can apply, but you have to wait till July 6th.
All right.
which
So
is only 2 weeks away. Based
and
to
that's
a little
the beautiful thing is they attended this webinar, so
right.
they are
And we do this every year with Visiting Angels, so we let
mhm.
people know that they have the opportunity to apply. You do want to apply. Each year our program gets bigger and bigger.
Okay.
So you want
Now,
to apply as soon as possible on July 6th.
speaking of application, next is approval, right? So question is, how long does the approval process take from the moment the family submits their printed profile to the ARC office until an agency like ours, Visiting Angels, can actually start coming to the home?
Well, it really depends, and we're hoping our online application will reduce how long it took. Typically, we say 30 business days, which is 45 days. But if you complete the online application and get it to us, and you know that you want to use Visiting Angels, for example, it could take maybe 5 days, maybe even less. We're hoping we the online application will make it easier, and especially if you have a provider already. We can even have a day where you can come in the office. We can fill out an app for you as long as you provide us with the supporting documents. It really depends on how fast we can get your doctor's physician health form in as well. So if we get everything in, it could take maybe 5 days as long as we get everything in. And we're hoping this will be the first year we're doing an online application. We're hoping that it speeds up, expedites the application process.
Speaking of application and signatures, whatnot, for example, if an application gets rejected or pushed back because of a missing signature, an incomplete form, do they start that waiting period all over again, or is there a fast track way to fix it?
It really depends what we're missing. The application has to be complete. And with the online application, it actually asks you, do you have these documents before you begin? So if you don't have them, there's no sense in starting them. All the questions on the application are mandatory, so you won't be able to move forward until you answer those questions. So the hard copy, a lot of people would miss signatures or sign. The new application online will not let you move forward until you answer that question.
Okay, so Z here is asking what are the supporting documents?
That's a great question, Z. So you are the primary caregiver. You must uh, provide us with a Maryland ID or driver's license. Your loved one, we must also have their Maryland ID or driver's license. If your loved one doesn't, they could provide us a Social Security award letter or a Maryland tax form. So the primary caregiver must have a Maryland ID or driver's license. The care recipient, which is your loved one you're caring for, must have a Maryland ID, driver's license. If they don't have that, we will accept a Social Security award letter or a Maryland tax form. And then your physician health form is a required document.
All right. Thank you for answering that question. Um, so some families probably are wondering, does the funding cover the cost entirely, or are there any hidden out-of-pocket administrative fees, co-pays, that the family needs to be prepared for?
That really depends on the provider you choose. Uh, we can pay right now, as we speak today, we can pay the home health care agency up to $33 an hour. Okay, and a lot of people ask, does that go straight to the aid? No, we use a residential service agency because they need to conduct background checks. They need to provide an assessment. There's a lot of administrative costs that go with aides and with their licensing and insurance. There's payroll, scheduling coordinators. This is a lot of work that they have to do to provide that care for your loved one. It's just not sending an aid. Insurance, licensing, training. And we're
Mm-hmm.
actually doing a survey of our consortium members to make sure they accept our rate. We let families know if the agency does not accept our rate, and we asked if you're okay with that. So some agencies we work with do not accept our rate. They charge anywhere from $2 to $8 more, we want to make sure that you're okay with paying that out of pocket.
Okay. Going back to the enrollment topic, once the enrollment window opens and a family submits everything, what is the very first thing they should do while waiting for the official approval letter to arrive? Would it be like, for
It will be,
example,
it would
yeah.
be an email saying that your
Okay.
application is approved, and then we were going to set up a schedule and orientation with you. So it's important to watch out for your email.
All right. Would like getting, an advanced in-home assessment help or
No, we can't really do that until we complete your application.
all right. Gotcha. Gotcha. Okay. Another question here. If a family requires a caregiver who speaks specific language like Spanish, for example, does the county consortium accommodate that, or is it strictly English speaking in nature?
No, as I said earlier, there are 27 different languages that are spoken in a respite program, and our consortium of providers speak 22 of them. So we have Visiting Angels has some Spanish-speaking caregivers. We have Tagalog, Philippine language. We have Amharic as well as a very large speaking languages. There are some languages that we can't find caregivers. Arabic is one of them. Mainly because a lot of people from those countries do not go into the home health. They don't go into being certified nursing assistants. And many non-English speaking caregivers don't also want to apply to get a certified nursing assistant. We try our best, but it's not guaranteed. I like to say that the giving and compassion is a universal language. There's a lot of technology that's out there that the caregiver can use. Translate.
Okay. Yeah. Here's another question. Can we get a copy of the doctor's form now so we can get an appointment with our doctor?
Unfortunately, not.
Okay. Um, Another question here. Can another family member become an aide and get paid for respite?
Absolutely not. That is in our program that we are not allowed to pay any family members. That is on the application.
Okay, okay. All right.
If you're
Here.
looking to get paid to be a caregiver, you need to get on a Medicaid waiver. They do that. Our program does not allow for it. It's very strict. We
Mm-hmm.
have very strict guidelines, and that's all outlined on the application.
Okay, okay. Those are the questions I have here. Any other questions from the floor? Okay. So while we wait, um, here's another question regarding
Sure.
paperwork. If a primary caregiver is a relative, like an adult, grandchild, but the home is technically owned by the senior whose name and signature go on the, I mean, whose name and signature go on the primary residency verification documents.
It's not okay. So you must be the unpaid live-in primary caregiver residing in the same household, caring for a senior or a person with a disability.
Okay. Oh, here's
The primary caregiver must reside in the same household. So example of that would be a spouse taking care of a spouse residing in the same household, a sibling taking care of a sibling in the same household, a grandchild taking care of a grandparent in the same household, a partner caring for his partner or her partner in the same household. Those are some examples of a primary caregiver, unpaid primary caregiver. You cannot access our program if you're on a Medicaid waiver. So someone wants to know about the hours. So all our home health care agencies want a minimum of 4 hours. So for every visit, you need at least 4 hours. They may be able to provide you services for less than that, but your rate may change. So if you only want 2 hours, they may charge you a higher rate than we can pay. We will pay up to 33, but for a 2 hour visit, it's very difficult to get an aide to work a 2 hour shift unless they're in a community like Leisure World where they will do cluster visits. But it's very difficult to get an aide to do anything less than 4 hours. So if you like 4 hours a week, that's going to be basically 16 to 20 hours per month. Some families just like to use it on Saturday, and they use it for when they go to service. They like to go to service, have breakfast or brunch with their congregation. Then they may go out and do some shopping. So they may want 10 hours every Sunday. Okay. So you're eligible for 120. You can use them however you want. We have families that will go on vacation every year. They can't take their loved one, and they let their loved one stay in assisted living, and they use their hours all up in 1 month. But the minimum is 4 hours for in-home respite.
Mm-hmm. Okay. Jules, while our attendees are taking notes on that, let's hit a quick logistical question about the forms, okay? So for the mandatory physician signature, does the county accept digital signatures, or should it be wet ink signature on a printed piece of paper?
No, our form is going to be online. All those forms will be online. It'll be digital. Right
Yes.
now, it's all hard copy, but we are working transition to an online application. So it'll all be digital. The health form will be sent to your physician's office. So this is the
Okay.
first time we're doing it. So we've been testing it, and so we hope not to have any hiccups, but you never know. But it will be sent to them. And again, if you have any questions during while you're filling this out, you can call us our office. We will walk you through it. Some seniors are not as comfortable with going online and filling out something with a computer, but we can assist you with that. We could do it over the phone. We could have you come in. We will be happy to assist you.
Beautiful. Here's a question. If
Sure.
a family receives approval, but let's say their care needs drastically increases 3 months into the fiscal year, for example, can they apply for readjustment, increase in hours, or are they locked into their initial allocation?
Well, right now, you're eligible to receive 120 hours. How you want to use them is up to you. But we understand that things change, but you are limited to no more than 10 hours a day. We can't say that we're going to give you any additional hours. Just strictly because each year our program grows and grows and grows. We ran out of funding in December. The county gave us an additional funding to reopen the application again. But I never guarantee any hours. And that's actually on the application. We never guarantee any hours because it really depends on how many people apply and how they use your hours. Again, some families come in and they use all their hours up in 1 month. So I encourage you not to hold on to your hours, but to use them. And remember, respite is designed to give you a break from caregiving. It is not designed for ongoing care. And if you need ongoing care, you really want to look into to see if you're eligible for the Medicaid waiver. But it's not designed for ongoing care. And we know we have families that really need ongoing care. But no, it's not 120 per month. It's you have the ability, if we have funding available, 120 hours in a fiscal year, but you can use 120 in a month if you'd like. When we meet with you, we're going to ask you how you want to use your hours, how many hours you're going to use in a month. So again, some families use 40 hours a month, and it gives them 3 months of respite. Some families like to spread them over 10 hours over a year, and as long as funding is available, we approve those. We go over that with you during the orientation period to make sure you understand how many hours can be used. We send an authorization form over to the agency, and they will also let you know. So for example, if you request 20 hours a month from us, we will authorize that and send them over to an agency like Visiting Angels. But when you're on the phone with Visiting Angels and you give them a schedule of 24 hours, but you tell us 20, they're going to ask you to call to increase the hours. So our home health care agencies are very familiar with this program.
Okay. I believe those are the questions we have, Jules.
Okay.
Are there any, messages you'd like to leave our audience right now?
No, we just look forward to helping you fill out the online application. Again, you want to go to our website on July 6th. I encourage you to apply as soon as possible so we can start giving you respite services. We so look forward to giving you a well-deserved break. We understand how caregiving impacts your own health, and we just look forward to giving you a break from caregiving. And if you need to call our office, I'll put that number in there. It's 301 984 5777. Please put in our extension, because if you hit 2 or another one, you want to call extension 120. Someone on my team will answer the phone. So please put in that extension 1204. That's super important so you don't get misdirected.
All right, there you go. We've
And you can
pasted that.
also email us at this email address that I'm putting in now if you have any questions or concerns.
Okay, I've repasted it in the chat box. Awesome. Is there any more, last minute questions, guys? Anyone? If none appearing, I believe
Okay.
that is a great session. We've answered
Thank you
lots of
so much,
questions.
sir, and thank you everyone for being on this call. I look forward to helping you. And if I could give you any during your orientation, once you apply, if you need any other resources, I'll be happy to give them. I have some caregiver resources that may be beneficial to you as well. So please, to your application, if you need any assistance, email or call us. And we look forward to giving you a break from caregiving. Take care now. Thank you so much,
Beautiful.
Dexter. Thank you, Visiting
Thank you,
Angels.
Jules.
You're
All right,
welcome.
for everybody, just watch out, stand by. I'll be editing this video, uploading it on YouTube, and sending you the replay link. And if Jules would prepare some resource for you, she'll be sending it to me with, the URL and the email addresses, the phone numbers that you need, and I'll just insert it in that email. As well, So,
Great.
last,
One last thing, Dexter. And throughout the year, we have training, we have fairs, resources. So once you're in our system, we let you know of events that are happening or training that are happening. We did a alternate therapy session last year where caregivers took part in music therapy, yoga, mindfulness. So we like to keep you in the loop. We helped many seniors get free computers from the county. So when we hear of services that are available to seniors, we'll let you know about that.
okay. So, yeah, this is beautiful session, beautiful episode. We hope to see you again next third Wednesday of the month. Every third Wednesday of the month, that is when we have these coffee chat sessions regularly.
At Visiting Angels, we're committed to enriching the lives of elders and their significant others. Our monthly coffee chat sessions aim to make your lives easier and better by providing quality information from our expert panelists. We're here to elevate your quality of life, offer practical wisdom, and ensure you have access to valuable insights.